Can you tell me about primitive reflexes returning in old age, how this affects cognitive decline and the research?
We have to know that the level of the gamma-aminobutyric acid in their life is changing. So it is really low when we were born, and after that, because of lots of movements, it will increase, and we will keep it until when we will be 6 years old, and after that it starts to decrease. And if somebody doesn't move enough, the decreasing is a little bit faster. And we found that if somebody does some sport regularly after when they are 60, this primitive reflex is more or less inhibited. But if somebody has a passive life and doesn't move so much, they have more primitive reflexes. And what we found, and what was really interesting, we tested their cognitive skills with mini-mental test, and we found that if somebody has lots of primitive reflexes, their mental state is weaker, significantly weaker. And not just primitive reflexes, their vestibular sensation is weaker, so the chance that they will fall over a little bit higher. The motor coordination is weaker as well, and the resilience, how can they cope with problems and how can they accommodate the changing environment, is less if somebody has lots of primitive reflexes. And we found that after 4 months doing exercises at least twice a week, the research group result in primitive reflexes and resilience and cognitive functions were much better than the control group who just live their everyday life.
Meaning that the brain is still very plastic, still very flexible in old age.